Health People presents Diabetes Reversal Roundtable with Mary Brown.
Hi, my name is Mary Brown. I've been diagnosed with diabetes in 2019. I really was kind of like, panicky, a little nervous because, I was already dealing with my mother with diabetes and I saw what she was going through. So in a way, I was kind of like a little panicky when I was first diagnosed because back then it was almost like having diabetes and things like that was like almost like a death sentence. When I joined the workshop with health people, at first it was almost like if I was a volunteer and I wanted joined it. I think my doctors had, when I went to the clinic, they had papers out on the desk and they just offered me something to read about and think about, and I happened to see that the health people, the workshop, I think it was like an 8 weeks course, and I thought it would be something interesting because I knew I was dealing with my mother with diabetes and I couldn't understand a lot of things, the mood swings, when should she be taking her medications, and I just wanted to be on top of it with my mother. But that's when afterwards I found out that I myself was a pre-diabetic. So I wanted to learn because I was hearing rumors, as I'm looking up on it, I'm reading about, that you can still live healthier. And so I already knew what was the problem. I just was trying to find a better solution because I couldn't see myself that they're saying that this is a death sentence and you have to live with it. So I was trying to fix me and my mother at the same time. And that's when I was introduced to health people. Once I started learning about it, I learned that it wasn't going to be an easy process because it's almost like a new beginning, because you have to change up a whole lot of your normal routines that you're used to doing. Your eating habits have to change. Your mind, your mental stability has to change, because this is like a forever process working on, because sometimes you'll be doing good and then sometimes you'll do that cheat time, and those are the days that you have to mix up with. But once you start getting into it and eating a certain way, the same way you adapt to other things, you end up adapting to taking care of your diabetes. Now I know that the diabetes is in my blood, so I know that if I don't take care of it, it can always come back, and that's what I don't want to happen. The future now is staying healthy now, and managing my diabetes, living healthier, and the thing about it feels good. I thought it would really, really be harder than I thought it was, but it's not. It's really not. It's really not. And sometimes you have fun doing it. You're experimenting with things. The food, you're starting to learn all of your natural and good proteins, fibers. You're starting to eat all like other different types of vegetables that you haven't eaten before, because now you know it has more nutrition in it and things like that. Just like the hardest thing was for me to do was to stop drinking the soda. But then when I started making the natural with the water, and maybe one day we'll put it up and we'll show you, and with the mixing the veggies with the lemon, lime, mint, and I mean it's so delicious that I don't even think about sodas and things no more. Now I want all of my natural food, and I'm 65 and I feel terrific. It's no more, I barely get headaches. There's no more my legs hurt, this hurt. For some reason, it seems like I do feel even more healthier than I ever did in my life. Yes, y'all have to watch it. It's called the Diabetes Reversal Roundtable. That will be coming to you soon. I will be doing some of I will be on the talk show. I'm pretty sure there will be others that has had adventures in reversing their diabetes. But I think it's a lovely show. We're going to be doing, we're going to be talking about different types of food. We're going to talk about how we felt when we first was diagnosed. We're also going to be talking about, what we can do, and, taking over the power of our life back again and dealing with diabetes. It's going to be a whole lot. I know it's going to be a lot of sensitive things come out, and maybe some people that's watching it empathize with it, and and then it might be good for those who didn't know that it can be reversed. So stay tuned to it. It's coming soon. You're welcome.